later as well. So to kick it off, Generate Health is a maternal and child health coalition. We were founded 20 years ago, and our mission is to mobilize the region to advance racial equity in pregnancy outcomes, family well-being, and child health in our community and we see our role in this crisis to convene this community and to share information about how people who are pregnant and postpartum are at risk for COVID-19, to coordinate resources that respond to the needs of service providers and community members, and to identify collective action opportunities. So today's webinar, we will have two parts. So first, we will hear from Brian Washington, the manager of planning and partnerships at Generate Health, about a new funding opportunity in response to the COVID-19 pandemic. Generate Health understands that as our world shifts, so do the needs of the community, and we want to respond to those needs. So Brian will share some more information about a funding opportunity to help meet those community needs. So following Brian, we will hear from Jessica Adams, founder and director of the St. Louis Area Diaper Bank, and Catherine Fennerson, who's an organizer with Action St. Louis, and they're going to talk to us a little bit more about this census and share some information about counting infants and communities of color while adhering to social distancing guidelines, and sharing some information about how the census is adapting to the COVID-19 crisis. We will have question and answers time after each of these sections. So once after Brian's presentation, and then again after the census presentation. So again, please use the Q&A box for your questions, and then use the chat box for any resources that you would like to share with the group. So without further ado, I'm going to hand it over to Brian.
All right, thank you, Abby. I want to start off by saying I appreciate the team for setting up this webinar and allowing me to share information about our funding opportunities. So I'm gonna go ahead and share my screen here. I do apologize for kind of how dark I am right now, just limited lighting, but if this is the worst part of our presentation, then I think we'll be doing pretty good. All right. Just give me a quick head nod if you can see my shared screen, see the PowerPoint. Perfect. You know, who Generate Health is, coalition of over nearly 300 organizations and 800 individuals with a common goal of creating some positive change for Black moms and their families in the St. Louis region. Our mission is to mobilize our St. Louis region to advance racial equity in terms of pregnancy outcomes. And we're doing this by a number of ways. As we all know, healthcare is not simply just what you do in terms of going to your doctor and what you're eating correctly. So we want to uncover the full picture of what impacts the health of moms and children. Willing to educate service providers about what really is happening around maternal and child health, and making sure we're connecting with community leaders as well, because it needs to be very much a collective impact. Advocating for certain improvements in policies. Sometimes policies are what's standing in the way of our moms and our families improving their health, and then mobilize the region around these pressing needs. We're not going to get there individually. The purpose is to come together and do this as a unit. So FLOURISH is this collective impact initiative, which is really brought out by collaboration between the Generate Health and the Missouri Foundation for Health. Missouri Foundation for Health really serves as the funder of this collective impact initiative, and Generate Health serves as the backbone to the organization. So we are essentially making sure everything's moving forward around infant mortality reduction. And we have a goal of reducing or eliminating racial disparities in infant mortality by 2033. So these bullet points you see here, just a few statistics around infant mortality in the St. Louis region. Infant mortality, as a definition, is really just the number of babies who unfortunately die before their first birthday. You see that Black babies are 3 times more likely to die than their white baby counterparts. And you see that third bullet point is just what we are able to do in terms of the number of children saved if we can make the impact we want to make. By bringing people together, as I mentioned in the previous slide, we can hopefully fix these systems that are negatively impacting Black families. So those are that we provide. So let's get into the meat of what this fund is. So as Abby mentioned before me, understanding that the COVID-19 pandemic has created quite the challenge for everyone, but especially those who are already facing particular challenges. We are very connected to community members, other agencies, other partners, and our community leaders cabinet has been fantastic in expressing their concerns about the lack of resources that are that they're dealing with, and what kind of responses are needed in order to support families. To support the region, Flourish has developed a COVID-19 response fund, so we can hopefully support our Black moms and their families during this especially difficult time. Grants will be awarded of up to $5,000 per project. We're allowing project or applicants to let us know what it is that they want to do and the timing in which that they can carry out their work. And I'll get a little bit of detail about what kind of things we're hearing about and what kind of projects could be taking place. But this is the grant award per granted partner once we get to that point. So we understand urgency is necessary. We are wanting to get this out as soon as we possibly can. So application cycle, if you will be fairly quick. Applications will be accepted on a weekly basis. They will be submitted to me via email. And you see my email right there. And we're going to get those applications in by 12 p.m. on Wednesday afternoons. I'll get into detail about the application itself a little bit later, but we want to make sure that not only was this a fast turnaround, but also fairly easy to complete, because one, time is of the essence, and two, we don't want to become a barrier to people who need to put some good things in the community and support families. So we want to make sure this is continuing on a weekly basis and that things are moving expeditiously. Applicants should be notified by the Friday of that week that their application was submitted. We'll just need a couple of days to review those applications, and you see the special projects committee comprised of Flourish staff to review those applications. So we're working hard to make sure that we are turning around those applications very quickly and dispersing, or at least getting the process going to disperse those funds to those applicant groups. So who's eligible for these funds? We want to make sure we're supporting neighborhood and community groups that are working to support community. This also goes for nonprofit organizations who focus on supporting our St. Louis region. Groups that are selected for funding must be a 501c3 organization in good standing with the state of Missouri, or have a fiscal sponsor who is a nonprofit 501c3 organization. To make this a little bit faster, we are not requiring that applicants have a fiscal sponsor in place by the time they submit their application, but there needs to be a fiscal sponsor for a group to get those funds. Luckily, we have a fantastic partner in Mosaic Beginnings who has secured a fiscal sponsor for one of our other funding opportunities, but our fiscal sponsor is very willing to support any groups who will need fiscal sponsorship for this funding opportunity. So knowing that we have that is fantastic, it's a blessing, and hopefully will not slow anything down. But we just didn't want to have that fiscal sponsor piece on the front end to slow anything down. So we'll take care of that if an applicant group just does not have a fiscal sponsor in place, or doesn't know how to secure one. And then the bottom bullet point there is just our non-discriminatory eligibility requirement that those who are using these funds do not discriminate on the basis of race, religion, sex, disability. I'm not going to read all those for you. Want to make sure that they're not being discriminatory in terms of who they're supporting. We want to make sure that people are getting what they need despite what their background or how they identify or whatever. There's more detail about eligibility requirements, but these are the big ones that I wanted to highlight today. So what kind of projects are we wanting to fund here? Examples of these projects, and this is not an exhaustive list, We understand that this is really impacting just about everything that we are used to. So we're open to anything that is outside of this list, as long as it's in line with supporting um, um, Black moms and their families in the St. Louis region. As we all have understood, there is just a really big challenge in getting certain supplies such as food and toiletries, daily basic needs for the home. Um, Providing formula and diapers is a big challenge or a big need that we're hearing. Just some of those essentials that families need just for day to day. Understanding that while the region has, stopped any shutoffs of utilities, I'm not sure that really goes for internets right now, but for utilities, there's not going to be any automatic shutoff for, back payment, but those bills still accrue. So if someone wanted to support their neighborhood, um, their church family, their people in their housing project, wherever they know people to be in need, we want to make sure that they're able to support those too, because whenever this ends, those dollars will still be due, and families are, maybe dealing with a lack of income as well. Technology is just about everywhere, and if you are out without it, you may need that to maybe access some virtual platforms to take care of some maybe virtual doctor's visits or anything that relates to your healthcare. So making sure that, if someone wants to cover something like that, that's eligible as well. And addressing any challenging when it comes to transportation needs. There's still a need to get groceries, there's still a need to get medicines. So making sure that those things are still being covered. And as I said, this is not an exhaustive list. I do want to highlight here that the intent is that these dollars are not for personal use. We want to make sure that we're serving a multitude of families, a multitude of individuals, and making sure that we're not just thinking about ourselves in this opportunity. We're not really wanting to ask a lot of granted partners. It's challenging enough dealing with the COVID-19 pandemic and all the challenges that it presents. So all we're asking is that you use the funds as they have been requested for. And then very importantly, that whatever you're doing, that you're still complying with the CDC guidelines for preventing the spread of COVID-19, as well as any rules and regulations that are enforced by local and state government. So still want you to do social distancing, 6 feet away, have your gloves, have your hand sanitizer, wash your hands, do everything that's smart in terms of preventing the spread. It's very possible, but that is going to be something that we're looking for in any submissions that we're getting to. You need to give us some detail about how you're going to do what you're going to do without putting yourself or anyone else in danger of spreading the virus. And then adhere to any evaluation requirements and provide the completed post-project evaluation survey. This may not be the most fun part of all of this, but we still want to know exactly what impact is being made. We're still doing evaluation on our end as an organization, and our funder will have evaluation as well. So there will be a very simple survey that we're asking all of our granted partners for this fund to complete, to give us some detail of just about what impact they've made, who they've impacted, maybe some other things that'll come out of that, challenges and what worked well, but there will be a post survey for this opportunity as well. I mentioned the application, and it is not the full scope of the questions here, but up front, we're not asking for a lot of applicants. We want to just get some basic contact information, who's applying, whether it's you in a group or whether it's a nonprofit organization, who's the best contact person for this opportunity, and what contact information can we have so that we have a good line of communication before, during, and after the work is done. And then the other 90% of this is just telling us what is it your project proposal is about. So this is, I think, like 4 of the 6 questions that are on the application, but just what does your group plan to do to support Black moms and families in this situation dealing with COVID-19? Provide a sort of breakdown of funds that will be used. We're not asking for a full-on, a completed, extensive budget, but we'll need you to explain in detail that kind of where dollars are going to be spent, so there's an understanding of kind of where those dollars are going to go, and that kind of helps the review committee as well. provide details on the target population. Where will you operate? Who will you impact? And especially, how will you impact that population? As much detail as you can possibly provide on just how you're going to do what it is you're going to do. That will also help the review committee understand exactly how you're going to make your impact. And then how will your group abide by the CDC guidelines? Just simply telling us that you're going to, stay this distance away, and people are going to be able to pick up things in their car and not leave it, however you're going to do your work. But just give us some detail of how you're going to provide what you're going to provide and adhere to those guidelines, because we want to make sure that you're handling things in a safe manner, and that you're not putting yourself or anyone else at risk. So how do you apply? I think I mentioned on the previous slide, everything will be submitted to me via email, and you have my email there. So go ahead and jot that down, or maybe someone put that in the chat for resources. And everything will be submitted by 12 p.m. on Wednesday afternoons. So everything we're asking for is either going to be in written or video format. There's detail in the actual application, and the application's online. But written format, if you want to put this in a Word document in a PDF format, just in case you don't want things to get edited mistakenly, it can be accepted in a PDF format and send as an attachment to me via email. If that stuff is stuff that you are not familiar with, you can put everything in the body of an email and just send that straight to me. We'll deal with that. In an event that someone wants to talk about their project outside, instead of writing it out, if you feel like that's an easier way for you to get across what it is you want to take care of, we're accepting video submissions. The formats in which we're accepting, those are on the application as well, but they're very common formats. I think the only one we're not accepting right now was a QuickTime video. But video submissions, due to the size of video files, or most video files anyway, we're going to accept those submissions via Dropbox. And in the application, there is a link to a Dropbox folder, and that'll come directly to a folder which I and another member of Generate Health staff have access to. So it'll be right there for us. But just let us know via email just how you're going to submit, and we'll be fine. And as I mentioned, successful applicants will be notified by that Friday of the same week. And whether you're going to get funded or not funded, we'll let you know by that Friday. I should have put that in the PowerPoint, but we'll be sure to get people some information about what their application was looking like for us, and are we able to fund it or not fund it. And if you're not funded, we definitely want to talk to you about just what it is, the information we're missing, and there can be another resubmission. So we want to make sure that we're doing all we can to support you and any other groups that have ideas about supporting the Black moms and their families. So in a scenario where your group is funded, what does that mean? You'll get an email from me saying congratulations. You've been funded for the amount you requested, and then we'll provide some detail about what next steps you'll have to take to secure your dollars. As I mentioned, there are some things we did not ask for on the front end, but we want to make sure that was the purpose for that was making sure that applications got in sooner than later. There are a few things that we will need just for processing purposes on the back end, and that is the Missouri Foundation for Health Conflict of Interest Disclosure Form. So to give some context, the dollars that we have are coming from the foundation. So there needs to be understanding of any conflicts that may arise. And if there necessarily is a conflict, that does not mean funds will not be provided. It's just that additional processing needs to take place. But that conflict of interest form takes about 5 or 10 seconds to complete. I've seen the form before, and it is something that hopefully doesn't take too long for applicant groups to complete. And then there's the award agreement letter. Funds will be released to the applicant or fiscal sponsor within a week of this letter being signed. These first two things that I talked about, these are required to get your funds. So without completing these, unfortunately, you will not be able to be funded. So that's why that contact information is so imperative that we have that. And then after the project, as I mentioned earlier, that post-project survey is required of all grant recipients to complete this survey after their work. Any unspent dollars must be returned to Generate Health STL 30 days after the final survey expenditure report has been submitted. So just make sure any dollars that aren't used are coming back. those dollars can go towards helping another group that's doing some good work in the community. So we'll be, very communicating very frequently or as frequent as we need to about just where you are and the dollars you have, and if there's anything that needs to come back. Any questions about this opportunity can come directly to me. So there is my email once again, and that's aligned to my phone. So give me a call, shoot me an email if you have any questions. If there's something you have questions about beforehand, if folks have questions as they're answering questions, shoot me a message and we'll be sure to, answer them to the best of our abilities. And if you don't follow us on any other platform, here are just some of our social media account pages so you can understand what's going on and stay up to date about what we're doing in our region, COVID-19 related or just in general. So with that, really concludes my PowerPoint presentation. And I think we can move towards questions and answers.
Great. Thank you, Brian. So the first question we have is if you could give an example of a couple of groups that might be eligible for funds. They asked for some examples.
Yeah, I meant to mention this also. So we have granted partners for a couple other grant opportunities that we have. Those organizations are also eligible because we understand that their life is different now too. They have to support families in their region differently too. So if they find a need that, thinks this grant opportunity could support, we're open to seeing those funds as well, or seeing those applications as well. But examples of groups, I would say if it's a nonprofit organization that is very connected to moms or families that is supporting families in terms of maybe their mental well-being, whether it's providing supplies, any organization that is engaged with community and really gets good information about what is needed in the community, they're all eligible. There's so many nonprofits, I don't know if I can really just name them all, but we're not strictly working with those either. So if you in your, if you know your church group, if you know that your church home has a number of members who need certain things, and there's a number of moms, there's a number of individuals who need access to medications, there's a number of people who are behind on their utility bills, a group could apply and saying, I want to support 20 people in getting these things. If you are in an apartment complex in a housing project, if there's a neighborhood group and you say, I want to apply and I want to make sure that we're covering these 15 households and getting some basic needs, covering food delivery from a grocery store or whatever it may be, they could apply. So it's fairly wide in terms of what we're looking for in terms of support of kind of groups in that regard. Hopefully that answers the question. It's the best answer I could probably provide.
Great, thanks. So is there a specific time frame in which the funds will have to be spent?
There is not. If you know that you can secure supplies for your project in 2 days and disperse it on a weekend, that's what maybe a 5-day turnaround. If that's fine. If you are periodically covering internet charges or for a group of people in your church family, your neighborhood, and you're going to cover it for 3 months, that's fine too. There is really no timetable that we're holding it to, mainly because we unfortunately do not know how long this is going to last and how long families are going to be impacted. So we're open to letting the applicant group let us know what they want to do.
Can we share the PowerPoint, Brian?
Yes, we can share the PowerPoint. So I'll make sure that's shareable. So maybe that's something we collaborate on, Abby, or how we get that out. I'm not sure, but
we can share it in the follow-up email that y'all will get. That way you can have information, and we will also make sure you have Brian's information as well as the website that has all of that for you all. And we can also put the PowerPoint on our on the Flourish website So you can have all that information kind of in one place and be able to share it with folks.
Mhm.
So feel free to send this information around once you get it as well.
Absolutely.
Can y'all still hear me? Yep.
Yes, I
Okay,
can hear
cool.
you.
Sorry, someone just told me I went out for a second. Okay. That's all the questions we have for right now. We're gonna do more Q&A after the census, folks. So if something comes up, we can address that then too. So thank you so much, Brian. That was awesome information. Again, we'll send out all of this. We'll get you Brian's contact information so that if you have any other questions that come up or any really specific things you want to talk with him about, you'll have his information. So thank you, Brian.
One more thing before I go. I think there was a question around restrictions for those awarded the grant. Not exactly sure what the person asking that is thinking in terms of restrictions. One thing that I think, excuse me, we want to make sure people are doing is just adhering to CDC guidelines, adhering to local government recommendations on social distancing and using protective equipment such as gloves and face masks, things like that. So I'm not sure what other restrictions could apply to this. I think the important thing for me to say is that it's just very important that applicant groups who submit are very clear about what they're doing and how it relates to supporting families in regards to the challenges that COVID-19 has presented. So it's not really a restriction thing, but I guess if it's hard for us to tell that what you're wanting to do relates to COVID-19 and removing a barrier or overcoming challenges, then that might be hard for us to really understand how this is supportive. But restrictions, I'm not sure what else to say outside of making sure you're adhering to the guidelines and recommendations for preventing the spread.
Cool.
I think
All right, thanks. And also somebody posted Brian's information in the chat box as well. So it's available in several different spaces. So feel free to reach out, especially if you have a really particular question about something you have in mind or somebody that you know might have in mind. So thank you again, Brian. That was fantastic information, and we're really excited to be able to respond to the needs of our community. So switching gears, it's very exciting. I know that you've been working really hard on this, so thanks for all your work. So switching gears just a little bit to move towards the census. So the census is an extremely important piece of all of our lives and all of our work that we do. So an accurate count plays into a lot of different things for the next 10 years. So things like representation, funding, and more. So we've got with us, so we're lucky to have two folks with us to talk about the census. So we have Jessica Adams, who's the director and founder of the St. Louis Area Diaper Bank. We also have Catherine Fennerson, who's an organizer with Action St. Louis. And these two will help us to understand the census, any changes and adjustments that have been made to respond to the COVID-19 crisis and ensure that we're able to get an accurate count, even though we're all staying home and social distancing as best as we can. And they'll help us understand what we can do to help get an accurate count. So I'm going to start by throwing it over to Catherine, and then we'll hear from Jessica. And again, please type your questions into the Q&A box. And then if you have any other resources to share, throw those into the chat box. So Catherine.
Morning. Again, I'm Catherine with Action St. Louis. And I just want to give a little bit of information. I'm not sure if everyone is familiar with Action St. Louis, but Action St. Louis was, born out of Ferguson, the Ferguson Uprising of 2014. It was initially organized as a coalition. And Action's history is rooted in the collective direct action against systemic racism and state violence. And we are a grassroots racial justice organization that seeks to build political power for Black communities in the St. Louis region. Action St. Louis builds campaigns that leverage organizing, communications, advocacy, and direct action to mitigate harm against our community while fighting for long-term transformation. So right now, the campaign that I am currently working on, because there's 4 of us there, but we all work on something different all the time. But my campaign is the census campaign. And so I'll just give you a little bit of background about the census. Just every 10 years, everyone who lives in the United States is asked to complete the census. This data becomes the basis of how billions of dollars are allocated annually to states and localities. The data from the census also informs how legislative maps are drawn for Congress, our state legislator, and local legislative bodies. Simply put, the census is really more about money and power. And when our communities don't complete the census, we lose. There's nothing, it's just we lose if we don't participate. In 2010, St. Louis suffered from an undercount, and we're still seeing the impact of that today. It is estimated that over 16,000 people in the city of St. Louis did not complete the census. That actually cost us a congressional district seat and leaving us with only 8 seats. And that seat that we lost was held by a Democrat. So today, only 2 of the 8 congressional seats that are held by Democrats. And so our state legislative maps are also drawn after the 2010 undercount. And since then, the Republicans have managed to gain a trifecta in Missouri, which means that our governor's seat, along with both of our state House representative and Senate, are all Republican controlled. And when our representation is weakened by an undercount, our power is diminished. So to ensure that St. Louis gets an accurate count this time around, Action St. Louis launched the We Count 314 campaign. And that's an initiative that focuses on increasing census completion in hard to count areas. Hard to count areas are areas where the census was completed less than 73%. So that means that out of everyone in the area, less than 73% of people in those areas filled out the census. And all of the hard to count areas in St. Louis City are concentrated on the north side, and there are parts of South City, and all of those areas are majority Black. And the hard to count areas in St. Louis County were mostly found in North County, and those were in mostly concentrated Black areas as well. So Black communities are historically undercounted, and the 2010 census undercounted Black people by more than 800,000. And Black children were undercounted at twice the rate of their non-Black peers, affecting federal funding allocations totaling over $800 billion for programs such as SNAP, TANF, the child care program, Section 8, Title I, which deals with poverty as it relates to schools, and the National School Lunch Program. And for every person, excuse me, that's not counted, our communities lose $13,000 per year, and that's for 10 years. So if you think about that, that's $130,000 per person that we are going to lose out when we do not fill out the census. And to get all of the funds that we deserve, we really need an accurate count. So at Action St. Louis, we have launched a strong digital campaign, and we have made over 15,000 calls to residents in those tracts right now through phone banking. But that's not enough. So far, only 37% of people in St. Louis have completed the census. In April of 2010, St. Louis was at nearly 50% completion rate. So we really all need to engage in outreach about the census because too much is at stake. Now is not the time to ease up and stop participating. It's actually quite the opposite. It's there's no secret that the virus infects people regardless of wealth. However, the poor will be the most affected due to longstanding segregation by income and race, reduced economic mobility, and the high cost of medical care. Low-income communities are more likely to be exposed to the virus. They have higher mortality rates, and they are suffering economically. In times of economic crisis, the vulnerabilities will be more pronounced for marginal groups, and those groups are usually identified by race, gender, and immigration status. And these are some of the factors that need to be addressed by filling out the census. The Census Bureau has extended the deadline for the response. Originally, it was July 31st, but it has been extended to October the 31st due to COVID-19. However, during this time, when we have the stay-at-home orders in place, we're asking you all to go to actionstl.org/WeCount. You can find updates, and also we have put a direct link in there where you can click on it and you can actually fill out the census if you have not done so thus far. In addition, we are in need of people to participate by filling out a number of petitions that can be found at actnowmissouri.org. These petitions deal directly with systems and policies that are being affected by the COVID-19 pandemic. There's actually a pledge to fill out the census that can be found there, in addition to petitions asking for more testing in certain areas, and also just protecting families and keeping them in their homes during this crisis. Uh, Also, Action St. Louis, we have partnered with many of the top organizations here in St. Louis and put together a list of demands and presented them to local and state leaders, speaking to their lack of response and protecting our most vulnerable residents in the area, including the working poor, the unhoused, pregnant women, and immunocompromised persons during this pandemic. And we need everyone to please visit stlcovidhub.org. I'll put all of these links in the chat so everyone will have access to them. But if you visit stlcovidhub.org, we're asking you all to fill out the petition just to hold our elected officials accountable during this time. Lastly, Action St. Louis, we will be holding a Twitter town hall on April the 30th, and we are going to be answering any questions people may have regarding the census, why it's important to fill out, how it affects us in our community. And we will be releasing more information in the next few days regarding, the time it'll start, as well as the hashtag that'll be posted on our website at actionstl.org. And you can also go to our Facebook and find information on there as well. And just for basic census information, you can go to my2020census.org. You can fill out the census there, and you could also call toll free at 844-330-2020. And any information that you need to fill out the census. And if you want to just fill it out online, you could go there and you can get that done as well. But if you all have any questions or or Jessica, I'll just kick it over to you. You can take it from there.
Sorry, slow on the mute button there. Hi, everybody. I'm Jess Adams. I'm the founder and the executive director of the St. Louis Area Diaper Bank, and I am by no means a census expert, so I'm grateful for Catherine's expertise and information that you just shared there. The Diaper Bank, as part of the National Diaper Bank Network this year, really has been engaged with our partner organizations. We have 56 partner organizations throughout the region who distribute our diapers to the families who are the end users who end up receiving them. And so we have done some work with our partner agencies trying to help our partners understand how important it is for all of the folks that they're serving to participate in the census. We work with several home visiting programs, Head Start programs, lots of programs, obviously, that are serving families with very young children, which we know are some of the hardest to count. And so that's sort of where I'm coming from today. What we talked about with our partners was just the fact, just I guess some kind of roadblocks that low-income families with very young children are kind of up against when it comes to filling out the census, and some things that we heard from our partner agencies, stuff that they were hearing from their families. Really kind of at the top of the list was this sense of mistrust about the way that data in the census gets used or shared. And so for us, one of the most important things to share with our partner agencies is just a reminder that census information is confidential and cannot be shared with anyone besides the census. So if there are families who are living together in apartments and they're worried about filling out the census with an accurate number of people in the household because they are afraid of a landlord finding out, just being able to offer a sense of reassurance that information is not going to go anywhere. The landlord can't have that access to that information. So that mistrusting, I think, was kind of the number one concern. And then, we've just talked a lot about making sure that everyone who is in the house, who's living in the house at that time that the census is responded to, is included. So even if somebody is, and I guess, correct me if I'm wrong on this, I hate to misspeak, but if you are in a home and doubled up with someone, it's still important to count all of the people, and especially all of those babies that are there at that time. Something that we have been sharing with families that seems to sort of resonate is just that if and like Catherine was saying, the census is about power and funding, but if families with very young children don't include those young children in the census, then really for the majority of the time that that child is going to be in school, there's not going to be funding there for that child. So they're going to go through almost their whole educational life without that funding that they need to support them. Those are sort of our biggest takeaways. We also think that overcoming some of these hurdles and boundaries are best done through relationships between providers and clients and the folks, those hard to reach families. So any organization that has relationships with families who we know are kind of either living in these hard to count areas or who are kind of falling into these hard to count categories, to really leverage those relationships to say like, hey, this is important. Do you need help? I'm here to support you in this, and to really walk through some of those maybe misconceptions or concerns about the way census data could be used.
Awesome. Jessica or Catherine, could you all touch on how to count if you're pregnant, and maybe if your child kind of goes back and forth between two households, some of those kind of questions that come up around, when and where to count, and, if there's extensions of time and those types of things?
I actually don't have a good answer for that, so I'm hoping Catherine does.
You're saying that they don't have a permanent residence, they just go in between?
So like if like it's maybe parents who live in separate places or separate homes, who counts a child maybe going back and forth?
It would be the one that has the person who actually has like the sole physical custody. I mean, in Missouri, typically it is the mother, if the baby is with the mother, the majority of the time, that is who would count the baby on the census.
Cool. And Catherine, can you touch on how to count if you're pregnant and you're due sometime in the next couple of months?
Actually, the census, as of right now, what we know, and this has not changed, it goes by who was actually living in your home as of April the 1st. So if the baby is not born yet, from what we've been told, you cannot count the baby if the baby was not born before April 1st. Now, if the baby was born on, March 30th, if the baby was born on March 29th, then absolutely, the baby needs to be counted. But I did not see where they have moved the information from April 1st being the day that whoever was living in your home on April 1st needs to be counted on the census.
Great. And so I know, Catherine, you touched a little bit on this, and Jessica, I'm sure some of the actions that you've been doing as well have been kind of in response to helping people count while social distancing. Is there anything you want to add to actions that we partners, individuals can do to help get that count even while we're social distancing?
What I know is that we really need everyone in the community, everyone that has the ability to. I know someone did speak about community cabinet leaders assisting. We need everyone to really just amplify the message. I mean, I don't know if you have email, if you have lists that you all work off of, that you have, people that you're in contact with, just email blast to, list, social media posts, that you can always go on the Action St. Louis page. And we always have, digital campaign, digital information speaking about the census and different ways that people can fill out the census. I know that what I spoke to, but I didn't speak to now, when the grassroots organizations, we were supposed to start this campaign, you know, from the beginning of the year up until May 1st. Before COVID, the Census Bureau itself was supposed to take over, you know, in May, because they are actually out in the field going door to door and doing all of that, which is what we were going to do prior to that. But since the COVID, that has been pushed out. So we actually have paid phone bankers right now that we have paid, but they are only there until May 1st. So after May 1st, we are definitely going to need volunteers. So if anyone wants to volunteer the phone bank, I can definitely give you, you know, my contact information. You can reach out, because we're going to need volunteers to pick up this slack that we'll have between May 1st and August the 11th, when the that is the date that the census will actually start hitting the field. So there's going to be a large gap of time where we're going to all need to work together to fill that in, because, you know, our paid workers won't be there anymore.
Okay, that's good to know. And you mentioned that on your website, y'all are putting updates. Are you just going to continue to provide that as it changes?
We will. Any information, we just got the information about the dates yesterday. There was a call yesterday that I was included on. So we will go this week and make the changes to the timeline, because the timeline that we have on there, you know, is what we had initially. But now that we have that, we'll go and change the census timeline. But we will definitely try to keep updating, and all of the newest information that we have, we'll put out.
Great, that's awesome, thanks. And Jessica, is there anything that folks can do that you can think of that would help and answer some of those barriers that you all have identified, help address those now, and kind of as we have this extended timeline as we go on?
Yeah, I mean, again, I think really it's all about those trusting relationships and really leveraging the relationships that folks have with people that they trust who are providing services to get that information. You know, in addition to all of the like digital ways to reach out to people, I think it's also important to make sure that there's information about how critical the census is whenever we're coming into contact with folks. So like the diaper bank is participating, you know, at the county library doing drive-through diapers, and I'm thinking actually that's a great place to get that information along with those diapers and food out to families about how the census works and how to make sure that they're counted. I think you know, for a lot of the families that we serve, they are maybe not living in their own household, but are like maybe living with grandma or living with a relative, or sort of in like a couch surfing situation. And just to remind the householders to count every single person who is in that house. Like I think sometimes, you know, grandma might get the census form and say like, okay, well, it's me, I live here in this house by myself, and you know, my kids are with me right now, but that's not the way it always is going to be. So I shouldn't count them, or I shouldn't count the babies because they're not my babies or whatever. So I think just like reminding folks that it's everybody in a household at the time the census form comes. But yeah, I think just anytime we're having contact with folks, this is an important thing to talk about.
Either of you have like a comprehensive like one pager or something that, you know, folks could just kind of like run off and throw into like food bags or porch drop-offs?
The diaper bank, we pulled together some information for our partners that we can make available to everyone here. I can share that with you guys, and you can send it out with the materials after the call. It is a pretty simple one pager. Yeah, I can definitely make that available.
We have one as well, and we actually just gave it to St. Louis Public and Charter Schools because they're going to include them in their meal bags as well. Just a one-pager with information, just with the We Count 314 campaign. So if you need that, I can definitely send that over to you as well.
That would be fantastic. Is there anything else that you two want to add in or put out into the space about the census or any of the work you're doing?
I just wanted to, and I know that we did speak, I mean, I know Jessica did speak also about the mistrust. One thing when we do call and we are phone banking, and when we speak to people, we definitely want to make them understand that we acknowledge that, we understand why they have a mistrust of the government. We understand, how, the most marginalized people have been affected, and how they can relate that to, things that have happened historically with our government. And one thing we just try to, let them know that, your feelings are absolutely valid. And however, this is something that, can help us and, try to get, some of, what they have lost back, and make them understand that, we understand and we empathize with them and we share those same feelings. So that's just something that I wanted to mention as well.
I think too, especially now, I think it feels like the census is sort of like, I don't know, in the background as we face this massive challenge that's really in our face. And so to talk with folks about how an accurate count now on this census will make our community better able to address issues like this in the future. So this is catastrophic, and yes, this feels like the top priority thing in everybody's face. How do we make it day to day? But to help kind of paint that picture for how the census will impact our response to, hopefully this never happens again, but to, crises in the future, that it's important that we know how many people are here.
Awesome. So we don't have any more questions. If y'all do have questions, we'll make sure that everybody's information is available. If that's okay with you, Jessica and Catherine.
Absolutely.
Great.
Absolutely.
Awesome. So we'll make sure that you all have information. So if anything comes up, or if you have really specific questions you didn't feel comfortable asking on the webinar, you can reach out and ask about those. Thank you again to Brian, Catherine, and Jessica for your time today and sharing all this awesome information. I know this was a really informative webinar, so it's exciting to go forth and conquer with the new information that we have. So thank you so much for taking the time to be here today. And also thank you to the Generate Health team, who has worked diligently behind the scenes to pull this together and make this a successful webinar. And a final thank you to everybody who logged on today and participated in today's webinar, for all that you do to take care of our moms and babies in our communities. So thank you so much. A couple of notes before we wrap up. It is April, it is National Minority Health Month, and more specifically right now, we are in the middle of Black Maternal Health Week, which is led by Black Mamas Matter Alliance. It's an awesome, awesome week of uplifting and centering Black mamas. So you can follow along with us and several organizations, including Black Mamas Matter, on social media. There's webinars, information sharing, and really a lot of learning about this year's theme, which is centering Black mamas. So be sure to check that out on social media. So following this call, you can expect to receive a link to this webinar and then the compiled information and resources that were shared, as well as a super quick survey that is super crucial in helping us continue to plan these webinars and ensure that these are informational and responsive to what you all are interested in hearing and seeing. So when you get all that information, please feel free to share it widely with all of your networks. We want to make sure that anybody who needs this information or is interested in this information has access to it. So feel free to share that. Generate Health will continue to host these weekly webinars for as long as they are helpful to folks and to our communities. So please join us back here next week, same time, same place, Wednesday, April 22nd at 10 a.m. Thanks everybody, stay safe.
Thank you.
Thank you. Bye-bye.